Guys, I've missed you so much after our last two talks on Babesia. And let's jump right into it. Now, we've written two books on herbs. One is a book on what I'm about ready to say. So you want more information, I think this is still the number one on Artemisia derivatives. So what's Artemisia? It's Artemisia ani, or sweet wormwood, and that will kill malaria. So if you're working in the fields and you're working in Artemisia fields, you may not get malaria, but it's completely worthless against Babesia. They are related, but it's much harder to kill Babesia. And it's understandable that people think, well, this kills malaria, which is no joke and can make much uglier forms inside of our blood cell than Babesia. So kills malaria, kills Babesia. No, not at all. So malaria may be more deadly, but Babesia is much harder to cure and kill. So we gave regular Artemisia to like doctors and other healthcare professionals at huge doses, and we didn't see any drop in the Babesia in the red blood cells. Well, there is a weak synthetic that can be very reasonable, particularly if you're sensitive and you're allergic to a lot of things like foods and multiple meds, not just penicillin, but more than you think is reasonable. And if you have mast cell activation syndrome, this might be okay to start with. And that's Artemisinin, and the end is ININ. ININ. That's being silly, just so you remember it. But it's fine to start with that and then raise the dose. And if you tolerate that, that's great. But then you need to transition always to a stronger synthetic, because we never found even high dose Artemisinin was curative. It did lower the body load a little. We'll take a little. If you're sensitive, that's okay. But I want to focus on one that I've done a lot of research on, and that's artesunate. So ART, like Picasso or Rembrandt, E as in England, and then ATE, like I ate too much at dinner. Artesunate. Now, it comes in many sizes. For example, in countries like India, I think about 50 to 400, as I recall. But in America, the problem is the only FDA-approved kind is what you can get in an emergency room if you have brain malaria. And they will give you IV 100 milligrams. Well, that may help brain malaria, but Babesia will laugh at it. It may stun Babesia and kill some, but you'll never be cured on 100 milligrams of artesunate by any group. So if you can get access to the tablets, and my patients in a number of different nations have no problem getting access to it, then I would start with 25 milligrams if you can, but never more than 50 milligrams. And ask yourself in the 16 hours after you take it, always with food, do I feel anything different? Is it hard to sleep? Do I feel more tired? Am I more cranky? Am I more restless? Is it hard to think? So those are some of the things, any of the killing of the infections that I'm talking about, that's a die-off of a wide number of infections. But if you're blowing up a single-cell parasite, you can certainly feel those often. And then if you're on 50 for, let's say, 7 to 10 days, I would go to 100. 100 is about when many people might feel it, or if you're on that for 7 to 10 days, 150. Most people with Babesia feel 150. And if it only kills malaria and Babesia, and it's very specific thing, and it may lower prostate cancer, but you're not going to feel that, then it may be something you should say, I really need thorough Babesia testing, not large commercial labs that have very old kits that miss it almost all the time. Get Babesia testing, ideally at more than one lab, because there is no almighty God lab. There's no prime minister, king, president lab. I may get testing for Babesia at a great lab and do another one, the other one detects it. So at any rate, artemisinin, we've gone up to 200 often, and on rare occasions 400 to 500, but only in people that aren't feeling uncomfortable with it, and there's no sign that it's bothering organs when you're doing basic tests for organ health. And this alone may kill malaria, but it's not going to cure Babesia. I think as a trend, anybody that tells you that one medicine or even two that are great medicines that I like are going to cure you, my appeal would be I'd like him to do serial blood smears with a microbiologist who's an expert on Babesia and prove to you it's cured. Yes, no, that doesn't really happen. And even the CDC in the past said that you just need to look at the smear and you're going to see it or not see it. That may be true often, but the microbiology, pathology-oriented expert that I used, one time I said, I think it's still there. It took them 5 hours to find that. Now, I respect the CDC that they updated that and say you may need to look at more than one smear. You may need to look at different samples of the blood. I respect that. They're trying to improve. But my appeal to them would be you need to improve more. And you can't depend on one tube of blood is going to have all the remaining Babesia. If you get down to 3% of red blood cells, you can't count on seeing it in any sample that day. Okay, so that is something to add herbs into the treatments. We did do a herb book in November of 2023, and it covers other herbs that kill Babesia, like cryptolepis, transresveratrol, which is a standardized and more powerful form of a herb you may have heard. I try to like standardized because it's more powerful typically. And there's others. And there's also kind of a wild finding that garlic essential oil, which is very powerful, with Zithromax can kill Babesia. So those are a few things that are not synthetic medications that may expand your treatment options for you or your treating doctor. Wish you the best. Have a great week and season in your healing. Bye-bye, gang.
I wrote the first Bartonella textbook in 2008, but this new one will be authoritative for many years.